Tonight, a consumer justice investigation exposing a massive waste of your tax dollars. Thousands of Medicaid patients are filling the emergency rooms with problems ranging from acne to bad breath, even ingrown nails.
And our Kristen Severance explains you are picking up the tab.
Yes, so we requested all Medicaid visits to ERs in Collin, Dallas, Denton, and Tarrant counties for the last year. We found you're paying millions of dollars for people to go to the ER for things like nightmares, bunions, and pregnancy tests.
It was just wearing on my mind and bothering me.
A sharp lower back pain on a Saturday sent Sherry Derrick to the emergency room.
They did some sonogram of my kidneys and things like that and let me know everything was fine.
She has insurance, but still owes $1,800 for the visit.
I don't care, and the reason I don't care is because, like I said, I was seen, I came out with a resolution, I feel like I got my money's worth.
Sherry prefers the ER to urgent care or her primary care physician. She says she can get in right away and the care is better.
I feel like I paid for it, and if I want to go to the ER, you know, it's my choice.
While Sherry pays for her non-emergency ER visits, Consumer Justice found tens of thousands of others in North Texas don't. Last year, your taxpayer dollars paid for more than 10,000 Medicaid patients to go to the ER for constipation and excessive gas. The cost, $3.8 million. And another $1 million for 6,600 people to go to the ER for diarrhea. Nearly $750,000 for more than 1,900 heartburn and acid reflux visits.
It's a huge drain on resources.
Dr. John Carlo is the president of the Dallas County Medical Society.
Medicare and Medicaid, that's of course your tax dollars that are going to support health care.
We found people choosing the ER for acne, bad breath, and nightmares, costing taxpayers $30,000. Pregnancy tests and birth control cost more than $150,000. And ER visits for bronchitis, coughs, and upper respiratory infections cost $12 million. Dr. Carlo said non-insured patients go to the ER for the same reasons Sherry does: quality of care and convenience.
Because they're easier to get to after hours visits. People that might have a job during the day and don't want to or cannot take time off.
Plus, they aren't paying, so it doesn't matter where they go.
There is no incentive to keep people out of the emergency room.
According to federal law, patients must be seen no matter the issue.
Which was great in theory. It's just kind of working out where it's become very costly to the taxpayer and really caused a logjam within a lot of emergency rooms.
State Senator Kelly Hancock represents Tarrant and Dallas counties and has passed a number of healthcare-related laws. We shared our data with his office.
It is a concern. What we would really like to see happen is people become more personally responsible in understanding and defining the difference between an emergency and maybe a cough.
Consumer Justice discovered the state can submit a waiver to the federal government that would allow Medicaid patients to be charged a copay for non-emergency visits. Supporters say while this wouldn't stop emergency room abuse, it could curb it.
I think we ought to look at waivers. If we find ways within the state of Texas that will address this issue and help resolve it, then absolutely I think we ought to move forward with a waiver request.
But Hancock warns against a one-size-fits-all policy that could hurt the people that need the care most.
We do want to make sure emergency rooms are addressing emergencies, but at the same time we got to make sure that we parse out the details and then we're not harming the individuals we're trying to help.
Hancock also said even a small copay could be too high for some people on Medicaid. He said the concern here is not to de-incentivize health care.
Well, and you think about budgets, right? That all makes sense. But what's next here? All right.
He's going to take our information, take our data, do their own research. They're going to get a large working group together and work on this until session starts. So, you know, I think there's going to be more to come on this one.
It's fascinating.
Huge problem, and it's interesting because the problem that you detail tonight leads to a story that we're going to do 1 week from tonight. We want to let you know homeless visits at JPS Hospital in 2015 added up to just short of $8 million. Huge money. Wow. But JPS came up with this idea, and you can think of this as homeless house calls. Exclusive access next week with the JPS Street Medicine team. This is making a difference for the hospital's bottom line. It's also making a difference for the homeless. Again, it airs 1 week from tonight.